Thank you for joining my presentation. I'm Michiel Franker from the Department of Surgery at Amsterdam UMC in the Netherlands, and I'll give a short presentation about the hospital costs of delayed gastric emptying following pancreatoduodenectomy and the financial headroom for novel prophylactic treatment strategies. Delayed gastric emptying is one of the most common complications following pancreatoduodenectomy, and patients can experience nausea, vomiting, and abdominal pain, for example. The in-hospital costs of delayed gastric emptying are currently unknown, and prophylactic treatment is currently lacking. We aim to estimate the in-hospital costs of delayed gastric emptying and to develop a model for the projected financial headroom per patient for novel prophylactic treatment strategies. We performed a retrospective analysis in a single center, and we included all consecutive pancreatoduodenectomies between 2010 and 2017. We only included clinically relevant delayed gastric emptying, which was grade B and C delayed gastric emptying as defined by the International Study Group of Pancreatic Surgery. We compared patients with delayed gastric emptying with other patient groups. And we modeled the financial headroom in relative risk reductions under different baseline risk scenarios of delayed gastric emptying. We included 581 patients with a total rate of 26.9% of grade B and C delayed gastric emptying. Isolated delayed gastric emptying added 10,295 euros over no complications, and other complications with delayed gastric emptying added 9,008 euro over other complications without delayed gastric emptying. Our model showed a financial headroom of 975 euro per 10% of absolute decrease of delayed gastric emptying risk. And this figure shows our model. On the y-axis, you can see the financial headroom in euro per patient for novel prophylactic treatment strategies of delayed gastric emptying. And on the x-axis, you can see the percentage of expected relative reduction in delayed gastric emptying due to novel prophylactic treatment strategies. And we modeled this under 4 different baseline scenarios of delayed gastric emptying. Delayed gastric emptying following pancreatoduodenectomy adds 9,000 to 10,000 euros to the in-hospital costs. And our online model shows the financial headroom for novel prophylactic treatments aim to reduce delayed gastric emptying following pancreatoduodenectomy, and is based on the extent of reduction in delayed gastric emptying and baseline risk. Thank you for listening to my presentation. And if you have any questions or comments, please feel free to let me know.